This is Dr. Kevin Lamb talking to you about peroneum syndrome of the ankle. We're going to look at some x-rays of what peroneum looks like on an x-ray. It's very self-evident. And we're going to go over a case. This is the peroneum by the blue arrows. As you can see, a little piece of bone on the side of the cuboid bone. That's an extra bone that people are born with. Again, this is from another view. You see those little blue arrows. That's people are born with that. It's called peroneum. It can cause instability, pain, and burning. This is a video talking about something called the peroneum syndrome. Peroneum syndrome is a extra piece of bone within a tendon of the ankle. Most of the time, patients are going to complain about burning outside the ankle or feeling instability and pain. And this could be very constant going down into the bottom of the foot. And here's the reason why. The tendon is called a peroneus longus tendon. And that tendon goes from this is the, looking at the foot model, this is the outside of your foot here. Looking at this, that's the outside of your foot. The fifth metatarsal is on this side. So 1, 2, 3, 4, 5. The peroneum is embedded usually in the tendon called the peroneus longus. This is where the tendon runs underneath. It hugs around this cuboid bone. If I can show this on here, hugs around this cuboid bone and wraps around to the bottom and goes into the foot, and it attaches and fans out and attaches to this area right about here, first metatarsal base as well as the medial cuneiform. So this tendon goes around from the ankle, behind the fibula, and around the cuboid. So a lot of times patients are going to have pain right here about the cuboid area, right about this area I can press, and down here. That's usually the symptoms that we would see in patients that complain about that. Something that can be very nondescript, but usually an x-ray like we showed you before is going to show that extra piece of bone called the peroneum. Sometimes they're big, sometimes they're smaller. And that bone within the tendon, as it goes around the cuboid, can tear the tendon itself, can tear the peroneus longus tendon. That's where people become symptomatic. Now, I've heard a doctor tell a patient that, hey, you've had this since you were born, so why are you having symptoms now? Well, the reason why these patients have symptoms later on in life is if they twist their foot the wrong way or they sprain their ankle, that bone within the tendon can cause a tear of the peroneus longus tendon. So imagine a rubber band, a tube going around this bone, and then you twist that ankle. There's also another piece of bone inside the ankle, which is the peroneum, inside the tendon, and that can cause a tear of the peroneus longus tendon. So that's why when patients, yes, you were born with this peroneum, it's not something that just showed up all of a sudden, but symptoms can show up all of a sudden after a traumatic event or chronic overuse syndrome. And now the video that I'm going to show towards the end of my discussion about this is a very active 59-year-old gentleman who's a runner who came in to me first for a consultation for the same exact problem. He went for a second opinion before the surgery and decided to come back for the other doctor did not give him any kind of answers. And the only answer the other doctor gave him was, well, you were born with this. I don't know why it's causing you symptoms right now. Now, again, it is true that you're born with it, and some people are asymptomatic until a traumatic event or chronic overuse syndrome causes a tear in the peroneus longus tendon. An MRI would give us a good indication if there's a tear or not. But there is a problem with the MRI though. It cannot tell you longitudinal or tears on the long axis of the tendon, the peroneus longus tendon, as accurately as it can tell a tear transversely if it goes across. And that's why I always try to explain to my patient, if we see swelling on the MRI, if we see any hint of a possible longitudinal tear, the best thing to do is if you continue to have pain and we try physical therapy and bracing and modified activities and it still bothers you, then it's time to surgically go in, take that piece of bone out, clean out the tendon, and repair the tendon. There's really no harm in doing that after you've been through conservative care and you still have a significant amount of pain. I'll leave you with the video of the patient interview. He's about a year post-op, and running more and more now that we have his osperineum syndrome taken care of. 2 years ago, subluxing and a peroneal tendon repair. The guy wasn't sure if the surgery would help him, right. Because but it's been 2 years now. So how you doing?
Doing really good.
Yeah, keep on pressing against. This is him going out towards me. You see the tendon, as you can see, the peroneal tendon right here. Keep a constant pressure on that. The peroneal tendon's right here. It's staying behind the fibula now. This is the follow-up to my other video about peroneal tendon subluxation and peroneal tendon tear. Unfortunately, this young man has, he is a runner, and he's had constant chronic pain right here because his peroneal tendon was actually torn along the fibula and subluxing or dislocating to the front. So after some convincing of, that the surgery may help him, now we're 2 years out, he does not have any pain, and you're continuing to run and do your activities. Am I correct, sir?
Marathon training.
Marathon training, yes. So no, he's doing very good. Mileage has gone back up again.
Yep.
Good.
15, 16, 17 miles.
Perfect, sir. Let's bring it out this way. Do that range of motion in the circle for me again. He's in excellent shape, as you can see. Fine definition of his muscles. No more dislocation. Ankle looks good. There's no more cracking upon. Keep on going right here. The incision is very fine, right behind the peroneal tendon. That's where I did the incision. That way we hide it, as well as allow for the repair of this peroneal complex right here. I'm keeping it behind the bone, so it's not popping out in front, so you won't get another tear again. Have you felt any instability of this ankle at all after?
I've got more stability than I have. I can run on uneven turf like I've never been able to do that.
Good.
It's like my ankles wanted to roll.
Yeah. Well, I mean,
I had to be very careful.
Well, you're doing great now because that tendon is not dislocating. You look like, after 2 years, this is great. And you have any suggestions for other people who have this kind of problem and are afraid or uncertain if the surgery will help them?
Don't delay.
Yeah.
Don't delay. Get it done.
Yes, sir.
Stay active.
100%. Don't go on a downward spiral. I mean, it looks great. That tendon, again, the peroneal tendon right here on this muscular guy here, going from here to here, and it stays behind the fibula. I mean, nothing complex here was done. I mean, just went ahead and deepened the groove a little bit with the peroneal tendon. So make a nice little groove. Put the peroneal tendon inside the cup, and so that way when he moves now, he's able to do his activities and get extra stability of the ankle.
Was back running in 3 months.
You're excellent patient, my man.
Do your therapy.
Therapy is obviously very important to help you increase strength. And at this point, man, you're pretty much better than you were before surgery, and you're off you go, my man.
Yes, very much so.